Hi, my name is Yara, and I'm in a group with Amber, Tyler, Jackie, and Abdullah. And we decided to do our project and final report on the social impact of Big Tobacco's marketing on low income neighborhoods. We did a lot of research on how these big corporations target these marginalized and low income blue collar communities, and we found some really important things that we wanted to share in this project.
Hi, my name is Jackie, and I'm going to be going over our research and the results we gained from our project. So, our project was based on the relationships and impacts of tobacco marketing and cigarette consumptions. So, tobacco companies have been strategic when it comes to reaching many different type of demographics, but mostly those of low income. Our research was going to help us understand the sparsity seen in tobacco marketing and how it influenced US consumers. Originally, for our research, we wanted to go out to different stores to witness how tobacco is being sold and all the different advertisements we can be exposed to then come up with questions to ask tobacco consumers. But due to COVID 19, we've been pretty limited in trying to get results based off that, and we had to alternate our research by deciding to make a survey. So then we created a survey on Qualtrics, which we had to share with friends on social media platforms or even classmates to see if we could get some kind of results for our research. So, our research was going to have not all the things we wanted, in which we wanted to reach a specific demographic, but ended up reaching a demographic that was mostly made up of college students or people around our age group, so 18 to 24 years old. But we just rolled with it since that was the only option we had. Our survey had over 11 questions on tobacco user demographics and also purchase involvement. We had over 41 entries, and we got our numbers based off that. When it comes to gender, we saw that males, 56%, had a higher rate of tobacco consumption compared to females, which was 39%. Age, 97% of the people that took the survey were between the ages 18 and 24, based off only being able to reach a particular demographic. Ethnicity, the minorities, so Hispanics with the 34% and African Americans with the 26%, were more vulnerable to falling into tobacco product consumption, and were mostly using those products most likely due to the effect it has on them, and also the reason for that had to correlate also with their income. So mostly those minorities fall under low incomes or middle low incomes, which brings out the side as to what our results were for incomes. So for our income results, we had most of the people identify as either low with a 24% or a middle low income, 26%. They felt more vulnerable to tobacco consumption. Marketing. When it came to marketing, majority of the influences were friends, 46%, and most likely was due to word of mouth, the fact that they consumed these tobacco products in front of their friends, and possibly even peer pressure. Based on the results, the tobacco industry has targeted many demographic groups, but try to appeal mostly to those that are from low income families and also identify as minorities. And when it comes to marketing, people tend to be the most prominent form of marketing, in which the tobacco industry sometimes doesn't have to do much. People usually expose other people to the product, which causes them to have other people decide to use it. And that's all. Thanks.
Hello, my name is Abdullah Jassim, and today I will be talking about big tobacco companies' marketing strategies and the way they market specifically towards people in low-income neighborhood and with a low socioeconomic status. Particularly, I'm going to dive into the individual and decision-making perspective of the topic. So, for decades now, tobacco companies have invested copious amounts of time and research and resources into finding cunning ways to get their products into the palm of our hands. And through this, we also know that packaging holds a much more significant purpose than to merely carry and protect the products. That being said, according to a study from the University of Nigeria, approximately 70% of all purchase decisions of goods are made at a point of purchase. One can conclude from this that packaging is fundamentally the only means of marketing communication that the consumer receives at that point. Another study shows that, according to the British Medical Journal, a shift from brand design based cigarette packaging to plain cigarette packaging could potentially lead to a significant reduction in the positive perception that a lot of young people have towards cigarettes. It's also important to note that point of sale marketing have become the main communications channel for tobacco marketing in the United States. And it's reported to be a source of exposure for tobacco marketing to more than 75% of the United States youths. It's also important to acknowledge the fact that point of sale marketing refers to any effort made to increase sales at the point in which the sale is taking place. So that's either at the cash register or when you're checking out online, etc. Tobacco products exemplify this kind of marketing concept really well because they consistently put out blatant posters and advertisements around places in which tobacco products are being sold, whether it be in the stores or in the neighborhood surrounding said store. This is a real concern, especially when you consider how many impressionable children and adults, such as those going through or battling drug addictions or alcohol withdrawals or trying to quit smoking cigarettes, walk into that store and see all those posters and are more tempted than ever to engage in such activities. So now another study conducted by Benjamin Toll in 2008 further establishes the importance of perceived risk and gender in moderating the impact of framed messages. Now, what we're discussing here is framing messages so that people can look at the positive impact of quitting smoking as opposed to the negative impact of smoking. So it's all about framing the messages to the perspective of an individual. And they found that women who received gain framed messages, i.e., messages that showed the benefits of quitting smoking, and had low perceived risk of cessation, i.e., meaning that they perceived the risk of quitting smoking to be less, i.e., they don't consider weight gain too much of a risk, etc., etc. They had way more days to their first cigarette after the study than people who were shown the lost frame messages. Information processing research like this is really crucial in us being able to combat big tobacco companies' advertisements, as well as being able to put anti-smoking ads and better frame the messages more efficiently to better tap into the people that are that are most susceptible to taking up smoking. That means being able to post gain frame messages on anti-smoking in low-income neighborhoods. So moving on, according to a study conducted by Neil Benowitz for the New England Journal of Medicine, nicotine activates nicotinic cholinergic receptors, triggering the release of neurotransmitters that produce psychoactive effects that are rewarding, such as dopamine. And this is what makes cigarettes so hard to quit. We're going to dive into this so that you can better understand how how tobacco companies are basically influencing the people to the point in which they have no other option but to purchase their cigarettes. So, with repeated exposure, tolerance develops to the effects of nicotine, thereby reducing its primary reinforcing effects, including and thus inducing physical dependence. Smoking behaviors are influenced by the feedback that you get from your own body, the response that your body has to the drug, as well as environmental factors such as social cues, influential relationships, and product advertising. The American Psychological Association reports that people with lower incomes experience more stress and have more traumatic events in their childhood than than the people living above the poverty line. Non-white Hispanics and African Americans also report having to deal with more stress than their white counterparts. This is in part to do with exposure to discrimination, which in turn leads to exposure to more violent and traumatic events throughout their childhood. Another study published by the Journal of Adolescent Health looks into the relationship between smoking behaviors and various psychographic segments. The study identified 4 segments categorized as risk seekers, stress pessimists, optimistic achievers, and sedentary, well-behaved individuals. The results concluded that risk seekers are the most susceptible to picking up the smoking habit, with 60% of them reported to have tried smoking, and pessimists coming in at second with 53% of them who have tried smoking. That's 2 times more than the optimistic achievers at 25% and sedentary, well-behaved individuals at 24%. The study also depicted that 20% of risk seekers and 22% of stress pessimists were current smokers compared to the 2% reported from the other 2 groups. Through various aforementioned studies, it's easy to make a connection that constructs a very clear, broadened idea of how big tobacco companies market their products in a very strategic way to capture an audience that are very, very susceptible to their type of marketing. To reiterate what we have spoken on, the mechanism of action that nicotine has on an individual allows for an almost immediate dependency on the drug. Stressed individuals, particularly those struggling with a mental illness and or behavioral issues, are far more susceptible to picking up the smoking habit. Minorities in America have reported to have more cases of stress, anxiety, and depression within their communities, making it particularly hard for them to quit smoking and making them a lot more susceptible to picking up the habit. It's important to also note that most of minorities typically fall into the risk seeker or stress pessimist category, as previously mentioned in one of these studies. This makes sense when you consider the facts. Minorities face discrimination on a daily basis, which in turn leads to a greater number of minorities suffering from depression, anxiety, etc. It all stems from a sense of fear in the community. This also means that minorities will have to adopt a risky mentality due to the discrimination that they've had to face all of their life. Realistically, a lot of people of color in America today still struggle to deal with everyday issues that their community goes through. And if they speak up on that, or if they try to act up on that, then there's a sense of fear that something might happen to them, or that they will not be heard. So it makes sense that they've had to develop a risky type of mentality in order to live their life. In fact, if you actually think about it, it wasn't long ago in 1981 that Michael Donald, an African-American man, was lynched by the KKK. This exactly shows why minorities are afraid. They have a lot of hate groups in America. The judicial system is against them. Police brutality and marketing campaigns and strategies are now working against them. So it's easy to see how big tobacco companies in this situation have really exploited social issues as well as economic issues and disparities in order to better target their more vulnerable customers. And that's all on my part. Thank you.
Hi, everyone. My name is Tyler Reed, and I'm going to be talking about socioeconomics and sociodemographics today with you guys. Socioeconomics is a major factor in whom and how big tobacco companies choose their advertisement towards. The topic is researched frequently, and within the last few years, the National Survey for Drug Use and Health did a survey conducted by the Center of Behavioral Health Statistics and Quality. Some interesting facts are found. They found 42% of people unemployed and over 26 consumed tobacco products, while just 26% that were employed did not. The same survey showed that 30% of adults who were below the poverty line used tobacco products, while 15% those twice the poverty level did not, which is also pretty considerable. The marketing term for this is considered a sin marketing, and it's similar to liquor being sold to low-income housings, just like we read about in the text under external influences. There was also a case where R.J. Reynolds fell into sin marketing, where he tried to sell cigarettes called Uptown Cigarettes to low-income Black families, but this was later shut down. The next topic is sociodemographics. Tobacco industry targets many people, groups, and communities based on their sociodemographics, and they have found relationships with sociodemographics with low socioeconomic groups as well. According to a study done by David Calham, tobacco use is far more prevalent in blue-collar industries such as construction workers. Actually, over 50% of construction workers use cigarettes or tobacco products, and there are 11.2 million construction workers, which is a very significant number. On the contrast, 25% of engineers and architects in white-collar jobs smoke tobacco products, which is a significant difference. To continue with sociodemographics, 34% of people who did not graduate high school and 37% of people who did not graduate college smoke tobacco products, which, in contrast to 18% of people who graduated college smoke tobacco products, which is a significant difference. 24% covered by health insurance smoke cigarettes or tobacco products, while 12% who have health insurance do not, which is according to the Substance Abuse and Mental Service Administrations, all of those facts. All these facts are tie into blue collars with less education and usually paid less, maybe not having health care, insurance, all that kind of things are much more tied to the use and prevalence of tobacco products.
In terms of cultural influences, marketers use cultural knowledge to market tobacco products globally. They target the cultures that consider tobacco use a norm. Since there is a large emphasis of tobacco in low-income and blue-collar jobs, we can also look at the cultural income here in the U.S. In fact, the median income for Hispanic and African Americans is only $30,000 per income, which is a very low level of income. Income level is strongly correlated to tobacco use, so these cultures within the U.S. have often been subject to the tobacco marketing. Global cultures have different norms, and some have a higher social acceptance of tobacco products. Around the world, Asian countries have the most prevalent tobacco usage, like for example, 70% of Indonesian people smoke tobacco. Marketers can also use this information within the U.S. to target areas with a high level of Asian citizens, but in reality, only 5.5% of Asian Americans smoke tobacco products.
So part 5 of our project is what we can do to combat this and combat the big tobacco industry and our recommendations to these organizations and consumers. Just to reiterate, after the research that was conducted, we found that these big tobacco industries target these marginalized and low-income communities. So what we can do is focus on our government and our politicians to pressure them and to kind of halt the money in politics that is used to further make legislation that is supporting these tobacco industries. So according to the American Lung Association, the FDA released restrictions in 2010 on the promotion that directly affects the big tobacco and how they could market. This is a direct quote from the FDA, that they issued a final rule that would place several restrictions on marketing and promotion of cigarettes and smokeless tobacco, including prohibiting brand name sponsorships of athletic, musical, or other social and cultural events. So essentially what this did was it didn't allow these big tobacco industries to put these famous athletes or musicians on these tobaccos to make individuals in society want to buy them or be like their idols. So that was a huge step moving forward, and I think to further progress and combat this is to move in that same direction where the FDA and the government can make legislation to halt the spread of the marketing of these corporations. There's another organization that I did want to note, which was Truth Initiative, that we took a lot of information from. And what they are, they're just a large organization that are committed to combating the use of tobacco, vaping, opioids, and providing support for those essentially who want to quit. How they describe themselves are groundbreaking research and policy studies, and they essentially give young people the facts about tobacco, Juuls, vaping, and all of that. So what we took from this was that these organizations like Truth Initiative, they go out and they send their lobbyists to the government, and essentially propose these anti-big tobacco industry legislations. And it has worked, considering from the bill from 2010, And a huge force in essentially ending or halting the tobacco industry marketing are some senators and congresswomen and men who do support the anti-tobacco movement. And a huge proponent of this is Senator Richard Blumenthal, and he's known for being one of these advocates. And he went on to describe the tobacco industry as having an influence in Washington in many different ways. And they have an active presence on the Hill. They meet frequently with administrative agencies on hugely significant issues such as regulation, e-cigarettes, tobacco packaging, and such. And I think that's a really good description on really what's going on right now in Washington, and the most important thing that we should focus on right now to combat this marketing is to put pressure on these politicians, vote them out, run campaigns on candidates that highlight these huge and massive donations coming from these corporations and PACs that really want to funnel money into Washington to have more groundbreaking and influence on these certain legislation in regards to FDA. So yeah, essentially what we want to do is halt the money that's coming into Washington and propose these anti-tobacco legislations to move forward.
To combat big tobacco's harm, several restrictions on marketing and promotions of cigarettes and smokeless tobacco have already been put in place, such as prohibiting brand name sponsorship of athletic, musical, or other social or cultural events. The organizations that are combating big tobacco need to stay on trend and provide valuable information to communities that are being targeted. Our main recommendation has to do with money in politics. The best way to combat it would be to filter out the politicians still being influenced by big tobacco and start encouraging the campaigns from candidates that would focus on the issues at hand and vote out the corrupt allies of tobacco lobbyists. Tackling the money that is funneled from big tobacco into the pockets of politicians would be a necessary and effective way to take the power away.